So we're just trying to look at some one or two, briefly look at illnesses, look at brief surgeries, we're just trying to do like that for this obstetrics and gynecology. So we look at what is known as the B-Lynch suture. B-Lynch suture. So for this B-Lynch suture, it's just a life-saving surgical technique. It's used in obstetrics to control postpartum hemorrhage. So the mother gave birth and she's bleeding so much. So you want to control all of that, So this is particularly caused by uterine atony. This is a condition where the uterus fails to contract effectively. The uterus is supposed to contract and all the blood vessels contract and close back for bleeding to stop. So if you have a problem with that, there's a type of surgery which is done known as the B-Lynch suture to help to prevent postpartum hemorrhage. Definition is a type of uterine compression suture that mechanically compress the uterus to stop bleeding. Okay, can you see from the anterior view? Can you see after they tied it, it's now compressed? All right. Inventor was Dr. Christopher B. Lynch in 1997. That was like 2 years before they gave birth to me. Purpose: to avoid hysterectomy and preserve fertility in women that have a lot of bleeding after they give birth. Okay. When is it used? Is applied when medications that can be given to contract the uterus if they fail. That's what uterotonics. All right. If the uterus is atonic and bleeding heavily, conservative measurements like uterine massage or balloon tamponade are ineffective. Patient is hemodynamically unstable and rapid intervention is needed. So how is it performed? First of all, the uterus is exposed via laparotomy. Laparotomy, they will open your stomach. So they will open down here because that's where the uterus is. Suture placement. A large absorbable suture is looped vertically around the uterus in a specific pattern just to compress it. This is what we're just talking about. Okay. So compression. The suture is tightened to apply pressure and stop the bleeding. Assessment. Hemostasis is confirmed before closing the abdomen. I see. Advantages: it preserves uterus and fertility, quick and relatively simple to perform, avoids major conditions that should come in if you don't do this one, like hysterectomy. It's effective in 91% of cases when used alone.